An update to a story that we told you about last week. There's a new study out that says there's a connection between going bald and heart disease, especially in men. Dr. Campbell here this morning to break it all down. Doctor, good to see you again.
Good to see you.
Okay, so first let's start with male pattern baldness. Explain it to us. Break it down a little bit here.
So in the study, there were really two types of baldness that they focused on. One is called crown or vertex baldness, which is the top of the head.
Right.
And the other is a receding hairline.
Right.
And what they found was that if you had crown-type baldness on the top of the head, you actually were at increased risk for heart disease.
Right. For the hairline, we could probably just not show video. We could just show my hairline, to be quite honest, making a joke out of here. But no, it's a very serious thing. What about the study on cardiac disease and baldness? Because that's eye-opening.
It really is. It was very interesting. It was an association found that was almost 50% more likely to have cardiac disease if you had the crown-type baldness on the head.
Okay.
If you just had the receding hairline, there was no association. Now, if you had both types of baldness together, it was almost 70% likely that you were going to have heart disease down the line.
Okay, so wait, receding hairline, no problem.
No problem.
I'm in good shape then. Perfect. All right, so how do we explain the increased risk for cardiac disease in men with male pattern baldness? I mean, I don't understand. You know, it's kind of hard to wrap your brain around in a sense. I mean, does it have to do with lifestyle or other things going on there?
A little bit. One of the things that we found is that it's a chronic state of inflammation when we see hair loss, and we know that inflammation relates to cardiac disease. Also, we probably have some shared risk factors, things like insulin resistance, which is a precursor to diabetes type 2. Things like high blood pressure, high cholesterol are related to hair loss and also related to heart disease. So I think that can help explain a little bit of that association. Okay, running out of time here real quick. Bottom line, what can we do? Is there anything we can do? I think it's important for physicians to use that as another clue on the trail to discovering heart disease in patients. If you have a patient with male pattern baldness, I think that gives you a reason to ask the right questions and look at risk factors to prevent cardiac disease.
Fascinating. Doctor, good to see you. Okay, of course, if you have a question for Dr. Campbell, real easy. All you have to do is log on to our website, WNCN.com. Click on links we mentioned. From there, we'll connect you to Dr. Campbell's website. Also, you can like his Facebook page and his Twitter.